So the DHI is made up of three main parts. There's the exploratory, which is the thing I'm going to say a little bit more about later, which is the kind of horizon scanning, future viewing part of DHI, which brings together people internationally and plots the future and gives us the edge in terms of real innovation. And then underneath that, there's the experience labs, and the experience labs are located in the area where health and care is really delivered, and it allows us to expose ideas and refine them to the point where we know that they're going to have good effects for health and care in Scotland and have the potential to build new companies on top of them. And then finally, there's the factory. And the factory is, if you like, the engine, the innovation engine for the DHI. And what that does is it pushes out things that we know stand a good chance of making themselves into a product or into a new service, and gets it out into the Scottish Health Service and into the economy. So the exploratory in the DHI is really about the future. It's about where we're going. It's about where should we be in 5 years' time, where should we be in 10 years' time. And that's something that you can't do inside one country, inside one set of boundaries. So what it's about is using our very strong links with the health services all over Europe and the world, strong links with academia and large and small companies to bring people together to really do the visionary work of working out what the roadmap should be for the next 5 years and really where the end point should be in 10 years' time. And that will take the form of reports, of videos, of recommendation, of policy statements, and it'll be about shaping Scotland's direction and shaping the role of the DHI as a beacon for research and innovation and the commercialisation of research across the whole of Europe and wider. When we look at the DHI, we see that it's set inside the whole of Europe, and the NHS in Scotland has really established itself as a leader in terms of service delivery across the whole of Europe. And we've got a very, very strong network in delivery, and we're building a stronger and stronger network in the academia and also the industry. And the diversity of the systems in Europe give us a huge advantage when it comes to trading and international competition, because if there's a health system done some way, it's probably done some way in Europe. And so what we can do is we can really build on that in terms of understanding the diversity and the needs of different populations and how we can bring products and services actually to lots and lots of different markets. But more than that, Europe's a source of really important investment and innovation funding, because we can see investment that goes right from very, very long scale research with 10, 15-year returns, right down to something which will fund procurement of things to get out there and really be tested. And we're positioning ourselves within the broader context of Europe to have very strong partnerships, and to have partnerships that are strong not just in delivery but also in the academic side and also the company side, so that we're very well positioned to make the strongest applications and make the most of Europe in promoting Scotland as a place to innovate in health and care delivery. Innovating in health and care, it critically depends on the quality of the people that you have doing it. So you need to have a flow of people who really understand the problem about innovating in health and care. And that's not just one skill. It takes skills in computing, it takes understanding to understand information, it takes skill in understanding medicine, it takes skill in understanding delivery, it takes skill in understanding what the business models are in order that you can actually get something out there successfully. And then critically over the whole thing, you need to have very good design, because this is about people being able to use this stuff. It's not about people muddling around trying to get it to work. It's something that fits smoothly into your daily routine. And what we've done within the DHI is we're starting a new master's programme, and the master's programme will not have students attending the usual classes. Rather, what they'll do is they'll say, this is what I need to learn to do this project, and they'll do a series of projects that are actually grounded in our experience labs, that are there actually out in the community delivering care but doing innovation at the same time. And that will give us a flow of people who are ready to be entrepreneurial and innovative, but also understand the system that they're working within and understand what people need in terms of health and care. And that's the core initial part of the work, but we'll go beyond that, because we'll work with NHS education and other training to make sure that it's not just at master's level, but that we cover the spectrum of skills that we need really to support health and care innovation in Scotland and really deliver within the timescales of DHI